begin with some COVID-19 updates. The Nigeria Center for Disease Control reported 126 new cases of coronavirus overnight, taking the country's total number of cases to 56,604.
The Federal Capital Territory recorded the highest number this time with 37 new infections, and followed by Lagos State with 27 cases. Other states on the list are Plateau State with 16 new cases, Kaduna with 9, and Abia with 7.
So far, 47,872 people have been discharged, while 1,091 people have died from COVID-19 complications. Health workers are at the fore of the battle against the coronavirus pandemic.
Some have even been infected in the line of duty. The United States is one of the countries that has been affected and is still being affected significantly by the COVID-19 pandemic.
Coronavirus-related deaths in the country is fast approaching 200,000. Joining us via Skype to discuss this is Esther Oshunlui, board member, National Association of Nigerian Nurses, California chapter. Good morning, and thank you so much for staying up to join us on the program this morning.
Thank you very much for having me, and good morning.
Good morning.
Right. Let's begin with your experience. Despite the challenges, the fear, the stigma, the concerns, talk to us what your experience was like being at the forefront.
Oh, thank you very much. In California, actually, we had like a head up because this happened, it started in New York. So in California, our first case was actually recorded in January. So we had time to actually prepare in California. As I speak to you, we have had 760,000 cases in the state of California. 14,000 of them have died. Over 14,000 people have died. And the majority are young people, like young adults from ages 18 to 49. Now in California, we were able to prepare. We were able to stock up on equipment, on PPEs. We were able to, come up with new procedures, new guidelines. Then when COVID hit, we were not prepared for it at all. Even with all the preparation, there was fear, there was anxiety among nurses. There were a lot of people were calling off. We had massive shortage of nurses. But thankfully, some people were adding on too. Some people were picking up extra shifts. But we had a lot of issues when it first started. But even in the midst of all these, we had people having depression, having anxiety. But you see, a lot of nurse leaders showed up. All of us, we started going to work in scrubs. We started helping on the floor. We were actually bundling care. We call it care bundling. So that by the time you go into the patient's room, you do everything you need to do so that you are not exposing yourself for too long. But in the midst of all this, we were with the patient 24/7 in their darkest hours. Even though we were scared that we could bring this home to our family members. Some family members were actually encouraging their family members to quit nursing. We had a lot of cases that the family members were encouraging them to quit nursing. But you know what? Even in the midst of all this, we saw the support from government, from organizations, from professional bodies, from faith organizations. They will bring us free food at work. They will bring up balloons. They will send personalized cards to each person. At work, it was, even in the midst of everything, we saw how good people could be. So that made it a little bit, better for us in America, but it was tough for Nigerian nurses.
All right, Esther, it's quite interesting to share how you got that motivation from the government and agencies that are involved, which is a good thing. However, you cannot have enough of that. But talk to us about the issue of easing of lockdowns and restrictions generally. There has been controversies all the while, but on the streets, from your observation, is everyone out now, up and about? Is that what is going on in California?
Okay, for California, California is peculiar. We started what we call a gradual surge. So we went up gradually, we reached a peak, then we started coming down. So we got to a state where we said we were at plateau, or so we thought. Then we started opening up. The 2 weeks was just going to the beach. People were not wearing masks. This was the point that actually almost broke nurses. This was when nurses became angry. Because before we were not angry, we were just scared and anxious and fearful, and we were doing what we needed to do. But when people started going out without wearing masks, that was when nurses and healthcare workers, that was when we became disillusioned. That was when we became angry. Some people are actually thinking of leaving this profession because of that. It's like, what's going on? As we speak, people still wear masks, but some people still do not wear masks. This is America. You cannot force people to do what they don't want.
Absolutely. Esther Oshuli, board member, National Association of Nigerian Nurses, California chapter. We must thank you for your time on the program this morning.
Thank you very much.
Right.